Okay, so have you ever when you feel that tickle in your throat and you're like, oh
Yeah.
no, here we go again.
Yeah, I know that
It's
feeling.
cold season, am I right?
Right.
And you just want to grab whatever you can to feel better.
Right.
But, we grab those cough drops. We grab, maybe some antihistamines left over from, allergy season.
Oh, yeah.
But are we even using the right stuff?
Good question.
So today we are going on a deep dive. And by the way, big thanks to London HeartbeatsZ Academy UK for the awesome material for today's deep dive.
Yeah, they're great.
We're going to be talking about colds and antihistamines. Like, what's the connection?
I'm excited for this.
Yeah.
Yeah.
And listen, make sure you're following us, okay? Facebook, Instagram, Spotify, and YouTube. We don't want you to miss out on these future deep dives. We got a lot of good stuff coming, a lot of good conversations coming. So today we're talking about colds and antihistamine. I mean, I think we can all relate to that feeling of like your nose is just constantly running.
Yes.
And, we just, out of habit, like I said, we reach for those allergy meds.
Yeah.
But should we?
Well, that's what we're going to figure out. But yeah, I mean, I think a lot of people just associate a runny nose with allergies,
I just
right?
feel bad.
And so they
Yeah.
immediately think, oh, I need my antihistamine.
Yep.
But to really see, like, if that makes sense, we kind of have to look at how those medications, how they actually do their thing.
Yeah.
What are they doing in our body?
Yeah, let's break it down. Like, they're not just, magic pills, right?
Right.
They're designed to do something very specific.
Exactly.
So what is that?
So basically, imagine you come into contact with something you're allergic to. Let's say, I don't know, pollen.
Ugh, pollen, the worst.
Right. So your body, it kind of freaks out a little bit. It's like, intruder alert,
Right.
and releases this chemical called histamine.
Okay.
And histamine, that's what causes all that fun stuff. The sneezing, the itchy eyes, the runny nose.
Oh, I know it well.
Yeah. So what antihistamines do is they block histamine from doing its thing.
So they're like, what's a
Yeah.
good analogy? Like bouncers at a club.
Yeah, I like that. They're like, hey, histamine, you're not getting in here and causing trouble.
Exactly. Keeping the peace, right? But then why, if they work so well for allergies, why don't they work the same way for the common cold?
That is the million-dollar question.
Right. I mean, runny nose is a runny nose, right?
Well, yeah. And that's where people get tripped up because while some of the symptoms might look the same, on the surface,
Yeah.
what's causing them is completely different.
Oh, okay.
Right. Allergies, like we were saying, that's your immune system overreacting to things that are actually harmless, like pollen.
Right, right.
But a cold, that's caused by a virus.
Uh-huh.
And a virus, that's a whole different ballgame. It's not something that antihistamines can really fight.
So it's kind of like trying to fix a flat tire with a hammer.
Yeah.
You need the right tool for the job, right?
Exactly.
But, I got to ask. I mean, I've heard people say that antihistamines do help them a little bit with their cold symptoms. Is there anything to that, or is it just, like, all in their head?
Well, it's possible they might be feeling a little relief. And that's because, antihistamines can help a little with nasal congestion,
Okay.
but they're not actually doing anything to fight the virus itself.
Right. So you're basically just masking the symptom.
Yeah, pretty
You're not dealing with the root cause.
Exactly.
Okay. So big takeaway here. Antihistamines, they might help a little bit with that runny nose,
Yeah.
but they are not the cure for the common cold. Nope. Knowing that can really help us make better choices, for our health.
Absolutely.
Huge thanks again to London HeartbeatsZ Academy UK.
Yeah, thank you.
Awesome material. And for all you listeners out there, this brings up another interesting question. If antihistamines aren't the answer for colds, then what is?
Right. Good question.
What are some other ways we can actually tackle those annoying cold symptoms? We'd love to hear your thoughts. Hit us up on social media.
Mucolytics, decongestants, and cough suppressants are all medications used to treat respiratory symptoms, but they work in different ways. Mucolytics thin and loosen mucus, making it easier to cough up. They are most commonly used to treat chronic lung conditions such as cystic fibrosis, chronic bronchitis, and emphysema. Examples of mucolytics include acetylcysteine, Mucomyst, and guaifenesin, Mucinex. Decongestants shrink swollen blood vessels in the nasal passages, making it easier to breathe. They are often used to treat congestion caused by colds, allergies, and sinusitis. Examples of decongestants include pseudoephedrine, Sudafed, and phenylephrine, Neosynephrine. Cough suppressants, also known as antitussives, reduce the urge to cough. They are most commonly used to treat dry, hacking coughs. Examples of cough suppressants include dextromethorphan, Robitussin DM, and codeine. Expectorants thin and loosen mucus in the chest, making it easier to cough up. They are most commonly used to treat coughs associated with colds, flu, and bronchitis. Examples of expectorants include guaifenesin, Mucinex, and bromexine, Bisolven. It is important to choose the right medication for your specific symptoms. If you are unsure which medication is right for you, talk to your doctor or pharmacist. Here are some important points to remember about using these medications. Mucolytics can cause stomach upset and diarrhea. Decongestants can cause nervousness, insomnia, and high blood pressure. Cough suppressants can cause drowsiness and dizziness. Expectorants can cause nausea and vomiting. It is important to follow the directions on the label carefully and to talk to your doctor or pharmacist if you have any questions.